How to prevent and respond to tachycardias, an expert's guide. Cardiac tachycardia is a rapid heart rate that lasts for more than a few seconds and can cause serious health complications. While it is a natural occurrence in some cases, it can also be an indication of other underlying medical conditions. As such, it is important to be aware of the signs, symptoms, and potential causes of tachycardia, as well as how to prevent and respond to this condition. In this guide, we will explore the different types of tachycardias, how to identify and prevent them, and how to respond when they occur. With the right knowledge, you can ensure that you are taking the best steps to prevent and respond to cardiac tachycardia and maintain your cardiovascular health. Types of tachycardias. Cardiac tachycardia is a fast and irregular heartbeat that results from a variety of causes. This type of tachycardia can be caused by a number of underlying medical conditions. In some cases, the cause of the tachycardia is known, while in other cases, the exact cause is unknown. Knowing the different types of tachycardia can help you better identify the cause of your heart rate and take necessary steps to prevent or treat the condition. Extrasystoles. An extrasystole occurs when the heart's electrical system briefly depolarizes before returning to its normal state. It is the opposite of a typical heartbeat and causes a slam in your heart rate. Supraventricular tachycardia. Supraventricular tachycardia is a type of arrhythmia that originates in the upper chambers of the heart. Wolff-Parkinson-White Syndrome. Wolff-Parkinson-White Syndrome is an inherited condition that causes an abnormal heartbeat that can lead to tachycardia. Signs and symptoms of tachycardia. Preventing and responding to tachycardia can help you identify the cause and manage the condition before it becomes too severe. If you experience any of the following signs, it could be an indication of cardiac tachycardia. A rapid heart rate or heartbeat is felt when there should be no heartbeat. Sometimes the heart beats faster than normal. The heartbeat is irregular or irregularly paced. Causes of tachycardia. There are several potential causes of cardiac tachycardia, including congenital heart conditions, cardiac diseases, and drugs. Some of the most common causes of cardiac tachycardia include congenital heart diseases, certain medications, electrolyte imbalances, and low blood oxygen levels. Certain heart diseases, including endocardial fibrosis, infective endocarditis, hypertrophic cardiomyopathy, and Wolff-Parkinson-White syndrome, can also lead to cardiac tachycardia. How to prevent cardiac tachycardia. Understanding the different types of tachycardia and how they occur can help you prevent cardiac tachycardia. Additionally, if you experience any of the signs or symptoms listed above, you should be especially vigilant and take action to prevent cardiac tachycardia. Avoid caffeine and alcohol, eat nutrient-rich foods, and increase your physical activity regularly to maintain good cardiovascular health and prevent tachycardia. If you take medications, take them at the right time and in the right amount. Certain drugs, including some types of antibiotics, calcium channel blockers, beta blockers, and digoxin, can cause tachycardia. Before taking any new medications, consult with your doctor or pharmacist to ensure that you are taking the appropriate precautions to prevent tachycardia. How to respond when tachycardia occurs. If you experience any of the signs or symptoms listed above, you should immediately seek medical attention. In addition to the need for urgent care, you should also take steps to prevent cardiac tachycardia. Avoid caffeinated beverages, alcohol, and fatty foods, and maintain a healthy diet. If you have been taking medications, it is especially important to stop and discuss any changes with your physician. Be aware of your surroundings at all times, and if you experience any of the signs or symptoms listed above, seek out medical attention immediately. When to seek medical attention. You should seek medical attention if you experience cardiac tachycardia, and it is difficult to slow or stop the heart rate. If you experience any of the following signs or symptoms, you should contact emergency medical services immediately. Signs or symptoms that are worsening. Attempting to slow the heart rate with shallow breathing or other nonspecific techniques. Difficulty breathing. Feeling lightheaded, faint, or dizzy. Weakness or lack of energy. Numbness or tingling in the extremities. Chest pain. Cardiac tachycardia treatment options. Rest and medication are the best ways to prevent cardiac tachycardia. If you experience the symptoms of cardiac tachycardia, you should focus on getting the heart rate down as quickly as possible. You can try to slow your heart rate by slowing your breathing and concentrating on the feeling of your diaphragm contracting. You can also try to stop the heart rate with a bradycardia device or by placing a cold compress on the chest. In some cases, medical professional may recommend an implantable cardioverter defibrillator, ICD. This type of device is used to treat life-threatening arrhythmias, including cardiac tachycardia. It is typically recommended by cardiologists and by patients who have suffered a serious cardiac arrest. Summary and conclusion. Cardiac tachycardia is a rapid heart rate that lasts for a few seconds or longer. While it is a natural occurrence in some cases, it can also be an indication of other underlying medical conditions. Knowing the signs, symptoms, and potential causes of tachycardia can help you prevent and manage the condition before it becomes severe. Cardiac tachycardia can be caused by a number of factors, including congenital heart conditions, certain medications, electrolyte imbalances, and low blood oxygen levels. Preventing cardiac tachycardia can help you identify and address the cause of your rapid heartbeat. If you experience any of the signs or symptoms listed above, you should seek medical attention immediately. To prevent cardiac tachycardia, try to avoid caffeine and alcohol, eat a nutrient-rich diet, and maintain a healthy lifestyle. If you take medications, take them at the right time and in the right amount. Finally, if you experience cardiac tachycardia, focus on lowering your heart rate and avoiding any sudden movements that could cause it to speed up again.